Bwana asifiwe. Bwana asifiwe tena. Kwa majina naitwa Mrs. Kenyare, Lucy Kenyare. Na zaidi hapo nimeokoka, Yesu ni Bwana. Our protocols observed, our reverend, visiting minister, the elders, and our congregants. Habari zenu. Anytime I start here, I want to say that I want us to be healthy. And today we have a gynecologist consultant from Avenue Healthcare, Dr. Maina, who is going to take us through. We are going to talk about cervical cancer. And cervical cancer is not basically about women, because men don't have a cervix, but they are couplets. No victimization, but the daktari will talk more, and it's good for us to be well informed. We are starting Cancer Month in October 1st, so it's good we start early. Just to mention something about Avenue Healthcare, we have a branch at Garden City, which is in our neighborhood, and they have a full French theater, so we don't have to go so far. We also have a branch in Parklands, we have another branch in Thika, and we work along very well with them. So at this point, I'll call in Dr. Maina to come and give the talk. Thank you.
Praise God. Praise God again. My name is Dr. Maina, as the chair, Lucy has mentioned. And I'm a gynecologist working with the Avenue Healthcare. And she has already told you we have a big branch here in Garden City, which is within your neighborhoods. So I think as the media team is trying to project the small presentation which we have, we want to talk about cervical cancer because of all the cancers that usually affect our citizenry. It is one of the most treatable cancers, and actually even preventable. So it is treatable if it is detected early, but also we are lucky that there are modalities of preventing it through vaccinations, but also through screening. And maybe in a nutshell, because I don't want to assume all of us know what the cervix is. The cervix is the door to the uterus. The uterus is where all of us were one day when the mothers were expectant. Pahali ambapo mtoto huwa anakaa ni uterus. So the entrance is the organ which is called the cervix. Now, cancer of the cervix, as I've said, affects women because it is women who have that organ. And maybe in terms of, for us to understand the impact, it is the number 4 commonest cancer amongst women. And the third bit is that in Kenya, it is the leading cause of cancer-related deaths. So of all cancers among women, cervical cancer is number 1 in terms of leading to deaths. Of course, there are other cancers like ovarian cancer, endometrial cancer, but in terms of deaths related to cancer in women, cervical cancer takes number 1. And, in the census, in the statistics that we usually take, it's been estimated that every single year, we have 5,000 new cases. Earlier on in the first service, I was told this church accommodates about 400, 500 people. So that is to mean, you can imagine this Thome church, if this accommodates 500 people, and we are talking about 5,000 new cases every year, so how many churches like these ones? How many churches? 10. Yeah? Is it 10? 10 churches. So a church here, another one elsewhere, 10 of them. All those people in that congregation, all of them, they get cancer. You can imagine. And every year, cancer of the cervix contributes to approximately 3,000 deaths. 3,000 per year. That is to mean, kanisa kama hii, zingine ngapi? 3,000 if you divide by 500 is like how many? So if you go to this, I don't know whether it's a constituency or what to call it, this area, you go to 6 churches which are full to capacity. Now you can imagine all those people now dying in a year. Are those good numbers? That is a very sad story. So that's the reason why we want to talk about cervical cancer. And one of the things I want to insist is that cervical cancer, if it is in early stages, usually doesn't have symptoms. But that one is the disadvantage in itself because it means that you would hardly know that you have it when it is in early stages. So what do? The most important thing before you even get the symptoms is to do what? Routine what? Routine checkup or routine screening. Because if you wait for the symptoms, it already means it is too late. And just so that we understand where does this cancer come from, because we are talking about cancers every now and then. And the reason why Lucy insisted that cervical cancer is a discussion for both men and women is because cervical cancer is a cancer that is associated with a virus called HPV, or human papilloma virus, which is a sexually transmitted virus. Now, 99% of all cancers of the cervix are associated with this virus. 99%. That means, one, if we improve our sexual habits, if we have safe sexual practices, or actually if we even have vaccinations against this virus, we can actually prevent what? The onset of cervical cancer. So which are the screening approaches that we have? And these screening approaches, we have them in the Garden City, Avenue Healthcare, as well as in other branches. So one of the commonest, and which is available in any facility you'll go, including our branch here and anywhere else, is Pap smear. So Pap smear is an easy to do, accessible, affordable test that you can do for screening. Pap smear is not for people who already have the cancer. It is for people who are healthy. If I assume all of us, let's say, are healthy, we are the candidates. We are the ones who are to be done screening. So do not wait for the symptoms. The symptoms, as maybe you might have heard either from friends or relatives or a colleague, include irregular bleeding. So we know that our ladies, our women, our sisters have monthly periods. But if you have abnormal bleeding, then it means that that's an alarm for you to go and get checked, because one of the things that can cause this irregular bleeding or bleeding before the time that you should have your menstrual period could be cervical cancer, amongst other things. Of course, there are other things like, having unusual discharge, which is, foul smelling, or having an odor, and you don't want to get there. So what are we calling ourselves to do? Go for this routine screening. Ideally, you can go for screening even on a yearly basis, but at least let not more than 3 years elapse before you go for screening. So it is recommended every 3 years you go for cervical cancer screening using a Pap smear. What else can you do apart from a Pap smear? As science develops, we have come up now with HPV DNA testing, which is a more specific kind of screening test. The reason why there is that testing, which is a DNA-based testing, is because cervical cancer is caused by high-risk viruses. So we say high risk because there are also other viruses which are not high risk. They don't lead to cancer. So HPV DNA, when you go to get that test done, if it is positive for the high risk viruses, then it means that the next step will be either to have a repeat follow-up, or number 2, to have an advanced test to confirm whether this high risk virus that has been found, has it actually caused cancerous changes to your cervix. And these HPV DNA plus Pap smears, they are usually available in most of our local facilities, so that's something you can go for. And because we have already said that whereas cancer of the cervix affects women, men cannot be left out of this equation, because we have already said that cancer of the cervix comes from HPV, and HPV comes from what? HPV comes from what? It is a sexually transmitted virus. So men have to be in this conversation, men have to be in this equation, so that we support our women, one, in going for screening. Number 2, we support them even emotionally and financially, not only for screening, but even sometimes for treatment if they are already, maybe they have already the disease. But even more importantly, so that in our homes, our children, our girls and our boys, we take them for vaccination. So vaccination is the next thing. It is recommended that preteens should get vaccinated. That is both boys and girls. And when I say preteens, I mean from around age 11 to 12. But you can start this vaccination even as early as 9 years of age. So if you have a youngster in the house, or a Gen, I don't know whether it's Gen Z or it's not Gen Alpha. Those ones, I think they are still the lower part of Gen Zs. The ones who are like around 11 to 12 years and thereabouts, take them for vaccination. These vaccines are available. And the recommendation is that the vaccination should begin at least from 9 years to around 15 years, so that you get these young people before they have their first sexual encounters. Because once you have their first sexual encounter, there is a high risk that you could actually get or contract this virus. And then if you miss that window, it means that you probably will need now more doses of the vaccination. So if you do the vaccinations between 9 to 15 years, you'll get 2 doses. So the first dose and another dose at least after 6 months. If you miss that window, you still have a chance of getting the vaccinations, but now you're going to get 3 doses. So the first dose, the second dose after about 1 to 2 months, and then the third dose after 6 months. So it's important to know the earlier you do the vaccination, the higher the prevention, and even probably the lesser the doses that you are going to take. Finally, it's a common statement that the vaccines are for people who are aged between 9 years to around 26 years. That is true. True in the sense that the biggest benefit is when you are vaccinated when you are very young. However, vaccination can be actually for any woman in the reproductive age group. That is all the way from 9 years to around even 45 years. So even as a woman who is in that age group, do not feel left behind. You can actually still benefit from vaccination because HPV virus will not cause cancer immediately. It usually takes time, about 10 to 15 years, for it to have those cancerous changes in the cervix. And therefore, if let's say you are 40 years, for instance, it means you still have many more years to live where the vaccine can actually be of benefit to you. But what is the take-home message? For our young girls, our young boys, let's target to get them vaccinated early. Let's not wait for them to get to 30 to 20. Let's go for annual or at least screening every 3 years. As men, let's take our women. Go and ask your wife today or your sister or even your colleague tomorrow at work. When is the last time you had a pap smear done? Have you done a pap smear? Have you ever, by show of hands, I want to see how many men have ever heard of pap smear? Show of hands. The men. Most likely women might have. Let me see the men who have heard about pap smears. Tuinue mkono vizuri hivi. So you see, it's not all of us. That means there's still an information gap, and we can support our women, we can support our wives, our daughters, and our sisters, so that we win the cancer journey together. We fight the cancer because it is treatable, it is preventable, and you can be able to screen for it. So thank you very much. You can see us outside the tent, outside the church, and also you can visit our Garden City branch as well as our other branches. Thank you very much for your time.
Excuse me, there is something that Daktari has missed that I feel that I must say, because it will not be complete if I don't say this. He talked about men. He talked about sexually transmitted disease. Let's be faithful to our partners. Let's avoid multiple partners. That he didn't say, because sexually transmitted disease will only come if you're not faithful to your partner. May God help us.
Ndege za omomo Bwana asifiwe sana.